Hello! Today we are going to look at a typical CT scanner set up in a clinical environment. Installing a CT scanner in a hospital requires a lot of preparation. The floors need to have adequate load carrying capacity. They also have to be anti-slip and anti-static due to the presence of sensitive electronic equipment inside the room. The walls must be constructed with X-ray absorbing material such as barium plaster. The most noticeable part of the scanner is the gantry, with a central opening into which the patient is moved during the examination. The detector and the X-ray tubes are located inside the gantry in opposite sides and rotate continuously around the patient. The X-ray tube is an essential part of the scanner. It produces the X-ray radiation that passes through the body. The role of the detector is to measure the amount of X-ray radiation going through the different organs and convert the radiation intensities into electrical signals. The electrical signals are then collected and stored in the computer as scan data. In some cases, in order to enhance the view of certain organs, the patient will be injected with a contrast agent, also called dye, before the scan. The dye highlights specific area inside the body, resulting in the clearer pictures. Iodine and barium are two dyes commonly used in CT scanning. In the next part of the course, we will introduce contrast agents and how they are used to improve a CT image quality. The table with the patient can be moved into or out of the gantry as well as up and down. This allows the patient to be appropriately positioned depending on which part of the body is being scanned. Here, the head will be scanned. A laser is used to align vertical and horizontal position of the body part. Before starting a scan, the radiographer will set up the imaging parameters depending on the area of the body that will be scanned. The voltage and the current used by the scanner will be displayed as well as the windowing parameters W and L. The radiographer can also check the estimation of the radiation dose delivered to the body part. In this case, the computed tomography dose index, indicated as CTDI volume, will give a measure of the dose deposited in a single slice of the patient as milligray. In order to calculate the total absorbed dose for a complete CT examination, the size of the body part that need to be scanned must be taken into account. The dose length product, represented here as DLP, is the product of C, T, DI, and the size of the body part. It is measured in milligray per centimeter. You will be able to learn more information regarding radiation dose with CT in the next session. For safety reasons, separate rooms must be provided for the CT scanner and the radiographers. The rooms must be isolated from each other by a special glass window. What makes it special is a LED to protect against X-ray radiation. A computer is used to reassemble and reconstruct the data collected by the detectors. By using different mathematical algorithms, the computer will produce digital image, also called 3D volumes. Then, the digital images will be converted into visible images, also called analog images. The display of this image on the monitor is made possible by using a windowing process. The radiographer uses software that automatically assigns Hounsfield units value between -1000 to over 1000 to every voxel of a CT image in order to analyze the data. The Hansfield unit is a concept that we will discuss in the next session. The digital images obtained after reconstructing all the images of the individual slice of the patient body are known as tomograms. This set of tomographic images forms the basis of the next phase of the process called the diagnosis. During diagnosis, the radiologist uses additional features of the software to identify a region of interest, also called ROI, to measure distances on the tomogram and display the attenuation coefficients of any of the slices. From the head scan images, 3 different views can be assessed: axial, sagittal, and coronal views. The parameters are displayed on the monitors. As you can see, 2 important parameters are now displayed: the window width W and the window level L. Both parameters are used to optimize the image contrast with the organs to be scanned. This is a 3D image of a heart during a CT angiography. As you can see, the windowing parameters here are set differently than for the previous head scan.